Okay, hey, it's Backyard Business, and here we are again. It's obviously fall. I kind of get a kick out if you've been following us. We had the beautiful warm summer, and all the foliage, and now it's fall. And we've had amazing people. And Anne Baum, talk about amazing. And what I was thinking is so interesting is that in a way I've been able to follow your career. When I first got here, you were just beginning, at least, not your career, but when I first, St. Luke's and then of course you became the chair of the chamber. You brought the Allentown and Bethlehem, the biggest partnership that we ever had, made that happen. Anyway, you've been a great asset to the Lehigh Valley. That's chamber talk, but you have. And you love it. You love what you do, right?
Oh, I absolutely do. And I would say the same for you, Tony. When we first met, you were just getting started in your chamber building. That's right. And look what you've accomplished. Yeah. It's amazing. It's made the Valley a better place by a long way.
You didn't like me when you first met me.
Well, it wasn't that I didn't like you personally.
The people I hung around with? No, I'm kidding.
When somebody says, oh, Tony, he's bad, and you're trying to figure out what to do, and then you build up this assumption about a person and a group. Yeah. But then you actually meet them and find out that they're not nearly as bad as you thought they were. And now we're friends. Yeah, really, which I love it.
Well, for those that don't know, so we were really on march to making the 6th largest chamber in the United States, and we had to bring the chambers together. The biggest move we ever made was the Allentown chamber and the Bethlehem chamber, and Ann was the chair. And then you became the chair of the overall chamber. And one thing I want to say about the Valley and you just came on the scene, became the chair, and this is a big board. People don't know, there's about at that time maybe 40, 45 people. Yeah. Never anything but total support. And I think it was just a credit to you and your personality, and that the reality is that the Valley was open to change and partnering, and the leader was the leader.
Well, thank you for saying that. I think you also helped connect us because you kept setting that vision of why this mattered in a really good way for the community, and never was there, I don't know about that person. There was no bad mouthing or bad talk. It was all positive and let's move forward together. And I think that combined with our Valley being really open to the opportunity that it presented, that's what all combined to make success.
You had to think, you must think, are there times now when you do think, look, you've got a great education and a great track record, but president of the Lehigh Valley Reilly Children's Hospital, is that a dream come true?
Well, it's interesting. It certainly is a culmination of all the experiences that I had. So everything that I learned along the way, whether it was when I was consulting, whether it was chairing the chamber or working through those mergers, whether it was Capital Blue Cross or owning my own business, everything that I did gave me little pieces that are helping me bring success to this role and really help our team succeed. And that's my job, is to get things out of their way, to solve problems, provide that vision and leadership for them, and really help them be the best that they can be in caring for kids.
That's a great point for younger women, younger leaders, period, that want to be leaders. When I think of that, St. Luke's, what you were doing there, and then you learn the other side at Capital. So the evolution of your career, you understand a lot of, by the time they must have been impressed when they hired you, because you understand, quote unquote, the business of healthcare. You've seen it from a lot of different sides.
Well, I think it's great to have a lot of experiences. So many people work in the same job in the same company for many years, and they're very good at what they do, but you don't get that opportunity to learn from other models, other innovations. And I've had that privilege to really have experiences that have enhanced my ability to understand how others are successful, so I can bring all that to the table.
You're always nice, pleasant, and whatever.
Oh,
do you have a temper? Do you ever? Yeah, I think I've seen you get mad. Not that I want to focus on your anger, but I've seen you. You don't get where you are. There are times when you had to be aggressive, if I want to use that term.
Yes, I think there's a difference between being blustery and angry and pounding your fist on the table. If I were pounding my fist on the table because I'm so mad, you would laugh. You're laughing right now, even imagining that. So that's not my style. But
I've seen you be strong and firm, though.
Yeah,
I think
expressing when something's not working well, or solving for issues when somebody's not behaving appropriately or operating with integrity. You have to call it out. You can't just be that punching bag and let people take advantage of you. But everybody has different ways that they express their frustration.
So Lehigh Valley Health Network, which is growing and now partnering. How do you feel about the partner? I mean, you obviously feel good. I mean, it's your organization.
Yes. Well, I am really excited from our perspective as a children's hospital.
Yeah.
Jefferson Health does not have a children's hospital within the network.
Perfect.
Currently, they don't have a level 4 NICU, which is our neonatal ICU. And there's such opportunity for us to work together with them to better serve the children of the Valley and the extended region.
So you and I say that, or as we're talking, they don't have a NICU, I think is a term used. And that's hospital talk. But when you have a child that's really sick and really needs it, I mean, this is something that many communities do not have.
Yes, so they do have a NICU, but they don't have the highest level, which is what we have.
But I'm saying some communities really
don't have it at all.
Yeah.
Correct.
And that's a big deal.
Yes. Yeah.
What's your thoughts on, what do you feel about the culture of LVHN? Do you like the culture? I'm a big culture person.
Yes, it's a great culture focused on safety, patient experience, and colleague experience. So everything we do is about keeping patients safe, helping to heal them, making sure that we can do everything that we can possibly do to make that experience the best that it can be. And when people are sick, nobody wants to go into the hospital. So we have to really go above and beyond to make it a great experience, and making sure that our colleagues are also having a great place to work, making sure that they have the resources they need to succeed, the tools, the training, so that they can deliver that safety. So it all comes full circle.
One thing I like about the evolution of Lehigh Valley, so many of my guests weren't like me. I was born here. Weren't born here. You were Chicago, as I
correct.
Yeah. Two things. Describe what growing up was. I think your dad was really a really well-known architect.
He was a civil engineer, and his expertise was reinforced concrete. Who knew, right? Well, because this was his expertise, he did a lot of work with FEMA and researching why buildings fall down.
Oh, okay.
So
that interests me. Wow.
Yeah. So
he'd be all over Florida right now, given the situation.
He would, yes. And his biggest project was he was the lead investigator on 9/11, why the Twin Towers came down.
Oh my gosh, really?
So he led the team that researched that. And then...
Did you get to talk to him about that?
Oh, sure. Yes.
Wow.
He did a ton of speaking engagements on it and was the expert on the structural failure and why it happened.
Well, I always think to myself when I watch it, an airplane that large going right into a building. I'm surprised that it stood the initial, and then of course it was the fire that got it. But wow, that's pretty cool. Yeah. Yeah.
The irony of it is the builder of the Twin Towers had said they could withstand getting hit by an airplane. And what really took them down was the heat from the fire that started to break down all of the structural supports.
That really, I don't want to belabor it about, but did that bother them that they could have done a better job since he was an engineer, or that maybe in the future you can do a better job?
He was always very focused on learning from things that didn't go well and building the standards so that you didn't make the same mistakes going forward. So he was all about building codes and making sure that whatever we could learn from things that failed would be built into those standards so that we avoided failure in the future.
So this very, what I would call a positive, kind determination you have, where does it come from? Your mom and your dad, or where would you say it comes from?
It must be genetic. I don't know. I've always been an optimist and hopeful, and have tried to find something positive in everything. My parents always said you can do anything you set your mind to. So I think that's a good platform to work from. And why not be positive? Why not try and find a way to accomplish
But it's not
things?
always easy. I mean, you've got to work at it,
Not
right? Some
always
people
easy.
think, oh, Anne's got it made. She's always happy, positive. I'm not saying anybody, but it's not. You've had your life. We've all have the.
Everybody
ups and downs.
has it. Yeah, everybody has it. And you find your way through and you keep your head up and you surround yourself with great people, family, friends, a great community, and that helps buoy you and carry you through.
What'd you think when you first got here, Lehigh Valley? How'd you get here? Why'd you get here?
I came here as a consultant with Premier, and I was doing a project at St. Luke's. And it was a great project, really exciting, and they asked me to stay. So I was really interested in the Valley. The people were so nice.
Yeah.
I was impressed. So we thought we'd stay here a year or two and then back to Chicago, but we absolutely fell in love with the Valley because there is nowhere in the country that I've ever been in. I've been to a lot of places as a consultant. There is nowhere like the Lehigh Valley on this planet.
Oh, wow.
Just amazing. The community, the corporate commitment to the Valley, our commitment to education and healthcare and wanting everyone to have a real fighting chance. That is something special.
Well, were you and Brad married at the time? Brad's your husband.
We were,
by the way. Yeah.
yes.
Yeah.
Yes,
Oh,
we
okay.
were.
So he had to find a job here, a gig here, or what? Or
Well, he actually at the time was selling gourmet sandwich spreads and it was mobile. So he was able, this is before working virtually,
Yeah.
he was able to work from here.
yeah. Was he a good gourmet sandwich spread person?
Yes, they had their biggest contract was Brugger's Bagels,
Oh,
which
yeah,
you might
sure.
remember,
Yeah, sure.
and very successful. But then he threw in his towel on the gourmet sandwich spread and worked in spine implants
Smart
for a
move.
striker.
Yeah. Well, that's a
Yes.
natural. Who doesn't
Yes,
go
a
from
natural
gourmet spread
switch.
to spinal? Yeah, I can see it happening. What are you optimistic? You're in healthcare, obviously, in a big way. What are you optimistic about and maybe concerned about? By the way, the new retail hospital in Macungie is just, I love this whole, I talked to Dr. Nestor on Business Matters years ago. I love this whole retail, gone are the singular large building, but now retail, easy access. But number one, do you think that's a good path for the future? And what are you excited about and maybe concerned about?
So I love this ability to provide excellent care close to home.
Mm-hmm.
So something like Macungie or Gilbertsville, those provide that access point. And then once somebody walks in the door, we're able to get them to whatever level of care they need. So they might be able to be cared for right there
Gotcha.
at that facility. But if they need that higher level of care, especially now with our Jefferson partnership, we can get them there. So it's very exciting. And that's something I'm very optimistic
So
about.
that brings the expertise, obviously. So it's not impossible that someone could start at Macungie and need to save their life or for the benefit, they might end up at a Jefferson in particular, if that would be the
Yes.
procedure they need.
Yes,
Oh.
absolutely. And the idea is that we make it easy for the patient. Now we're new to this, so it will take
Sure.
some time to
Yeah.
build it. But healthcare is complicated. It's confusing. And for us to be able to help somebody find their way to the best level of care that they need to live their best life, that's what we're all about.
What challenges? Any big challenge? I mean, we all have it today, economics or whatever.
I think that our biggest challenges are really threefold. One is staffing, just having enough nurses and physicians and techs to provide the care that people need. So having that workforce being built so that they're ready to come and work for us. And that's even further complicated in pediatrics because there are just fewer subspecialists in that area. So that's the
and if you're running a
first.
business, your labor costs, if there's a high demand, you're going to be paying people. So that's got to be, it's got to be daunting.
Yes, so that's a big one. Obviously, reimbursement for the healthcare system overall. I'm sure you've heard Dr. Nestor say that it's really complicated and it gets more complicated all the time. So making sure that we can provide those resources so that people can get what they need when they need it. And I think the third thing is just in general, the health of our population. So I really believe that people think no matter what happens to them, there's some magic pill or surgery to get there. And it's not that easy.
Love it.
If you
Love
have
it.
a heart attack and you need open heart surgery, you're never the same as you were before you had that heart attack.
So maybe change your habits.
Yeah,
so you're not back. Yes, I get it.
and that's where I'm excited about the Blue Zones
Oh,
project
yeah.
that we're working on, which really encourages making the healthy choice the easy choice.
Yeah, you're right. People, the easy choice sometimes is, well, okay, I had the surgery and I have a medication. I'll just go back to the same behavior, and before you know it, you're back again. So
Right.
people can take their health more seriously. I'm getting a sign that we're out of time, and we've known each other for a while.
Long time.
And,
Let's not tell anybody how long.
Exactly. But no, I think you're amazing. You've been a friend, you've been a mentor, you've been a colleague, and every time we need you, you're there. I guess really I would say every time the Valley needs you, you're there. And when I think of this crazy, incredible career, I'm proud of you, and I wish you all the best in this new role. It's a big time role, so congrats.
Well, thank you, Tony, and likewise.
Yeah.
It has been a pleasure growing up with you.
Yeah. You're thinking I'm going to be out of here? Like you would like to get rid of me in about a little bit?
No.
Okay. All right. Why would I think that? Because I'm paranoid? Would that be the answer?
Aren't you Paratony?
Yeah, paratony. That's what I call it. All right, Anne Baum. Love Anne Baum. Thank you all. And backyard business, and we'll see you soon.